Tyler, the floor is yours.
Okay, thank you, Anna. Hi, everyone. I hope you're all doing good today. I'm going to share my screen now and give you guys our presentation. Okay, hi, everyone. Welcome. This is the Health and Medical Care Archive at Icpsr. This is one of several sub-archives within the General Archive. And here's how our presentation is going to go down today. So I'm going to give you a background and an introduction, talk about our goals, talk about the history a little bit of this archive, and how we operate and the sort of stuff that we house and do here. So first, here's our archive team. It's made of 3 people right now. We have our director, Dr. Amy Pienta. We have the project manager, Sarah Britt, and then myself, the project assistant. And we all work together to make sure everything runs smoothly, to make sure the curation stuff comes out on time, and talk between our funder and the rest of the archive and stuff like that. And here's pretty much what we are and what we do. So the Health and Medical Care Archive, or HMCA, is the data archive of the Robert Wood Johnson Foundation. And I'll talk a little bit more about what that is exactly, but essentially the Robert Wood Johnson Foundation, if you're not already familiar with it, funds research that has to do with health, healthcare, public health, pretty much anything related to health in the US. And we are this dedicated archive to all of that research that goes on. And so our goal, well, I'll start first with the Rwjf goal, and that's Robert Wood Johnson Foundation. So RWJF's goal is to foster a culture of health in the US through research and other means. And our goal is aligned to that by offering the data that these researchers make and create, and archiving it and letting other people analyze it later on. So you can read that. That's pretty much the goal of this archive right here. If you guys have any questions, feel free to just pop them in. If it's really pressing, I'll answer it real quick. And if not, I'll just wait till the end. But yeah, here's a little bit of the history. So this foundation, the Robert Wood Johnson Foundation, was founded in 1972. It was actually founded after the death of Robert Wood Johnson. But Robert Wood Johnson essentially came from the Johnson & Johnson Company family. And he started a foundation, which is kind of like the precursor to RWJF, as sorry, someone just popped in on the screen down there. It was kind of like a precursor to RWJF, and it's called the Johnson New Brunswick Foundation. And essentially this foundation was Robert Wood Johnson's response to giving community and neighborhood aid during the Depression. So since this family had a lot of money and a lot of means to help people, Robert Wood Johnson specifically started this foundation, I think it was like 1938, in order to help the people that were in his neighborhood who didn't have housing or needed other sorts of financial help. And then the war came, and he actually went and did stuff in the war with the US. And when he came back, he had a very strong healthcare emphasis with this foundation that he had. So essentially, he saw a lot of the horror, a lot of the post-war horror. So people who suffered through really bad healthcare, essentially, since in Europe there was little healthcare available to people at the time. He had this healthcare emphasis for the foundation, and that's kind of where all of this started. But that's just a little bit of background, a little bit of history. And here's just a run through of our affiliations. So we're the archive, HMCA, Health and Medical Care Archive, and it's dedicated to all the research that's funded by the RWJF, Robert Wood Johnson Foundation. And this archive is operated by Icpsr at the University of Michigan. So the funder is RWJF. They provide the grants for the researchers, and part of the grant stipulation is that all the data has to be archived with us. So we already have a queue built up, excuse me, of all the research that's being researched right now and all the people that have grants right now. and we're getting their data as they go through, and then we curate it, and then we archive it. And that's just one thing I guess I should note real quick. Yeah, so here's another overview. This is how we do it. RWJF funds the research. So they kind of decide what research they want, and then we collect the data from there. So we don't really get to say, oh, we want to see this in our archive. We just archive what they have for us. It's curated through Icpsr, and then we just hold it forever, essentially, so people can reference it, do secondary analysis and stuff like that. But on this first point right here, one thing to note is that only RWJF research is in our archive. So you won't be able to find like stuff from the NIH or things like that. This is specific to Robert Wood Johnson Foundation funded research. But with that being said, we've still got quite a lot of interesting stuff in our archive. So we've got over 200 large-scale surveys. So these are surveys of the general population of the United States. Some of them are longitudinal, so we have some series within our archive, but they're all covering public health, health reform, access to care, stuff like that. There's quite a few other surveys that cover outreach and healthcare outreach programs. So they do like evaluations of these programs. And we have just about 250 variables for you to look at based off of all the research and all the data that we have in the archive. And then there's over 6,000 data-related publications. So these are the publications that the primary investigators publish, but some of these are also from secondary analysis. And there's a lot of stuff you look at. So if you want to just come see what's been published, if you want to come actually get some data, do your own analyses, you can do that. We're here for all of that stuff. And this is kind of how our website goes down. So when you first go to our website, there's just this logo and like a really giant search bar. And you can just click the search and it takes you to this page. And this will take you to the most recent survey that we released. And this is the most recent one we have. And this is actually a little bit different from what we usually see. I don't think we have a lot of gun safety surveys in our archive. So this is kind of an interesting one. So if any of you are doing research on that right now, or you would like to just figure out or find out more about this sort of thing, stop on by and click on it and see what's been asked. You can see the variables, you can see the, if you download the data set, you can see responses and stuff like that. And here's an example of one of our series. So this survey down here at the bottom, I hope you can see what I'm pointing to. This survey right here is part of a larger series that examines public health outreach within different states and territories within the US. And it's really interesting too. And there's a lot of research that's been done through this series. And besides just archiving data, we also host informational webinars. We do data workshops through the summer program. So our most recent webinar, it's actually on the Icpsr's YouTube page, and it's on our social media page. We have a link to it, so you can just check it out if you want. But that was about social determinants of health. So since we talk about healthcare and access to healthcare and stuff like that, we were able to get some of the researchers that have deposited, I think, their data through us to give a webinar. So it was actually really interesting if you guys want to check that out. We do data workshops. So just recently we had our Icpsr summer program, and the director of this program, Dr. Amy Pienta, gave a workshop. And we also have interoperability with other RWJF funded research and archives, research centers and archives. So I don't know if you guys are familiar with the Roper Center, but I'm just going to talk about it real quick. This is also another RWJF funded center that houses data from nationally representative Harvard surveys, and I think surveys done by the NPR. And we have this like interoperability thing where you can search for these data within our archive, and it'll like kind of hyperlink you to the Roper Center and let you have access to what's in the Roper Center and vice versa. So if you're looking at stuff in the Roper Center, but we have it over here. You should be able to access it because they work together like that. And then we try to do some outreach too. So we do things like this, participate in this event. We do a lot of social media outreach. So we do post frequently, and we try to reach student groups or public health interest groups and stuff like that to follow us, to come get data and do research with us and stuff like that. And we even have this Icpsr online analysis tool for some of our surveys. I'm going to show you what that is right now. Okay, so the Icpsr gave access to pretty much an online light. So think of it like as a light version of SPSS, R analysis software like that. And you can access this through our website. So this is open to anyone. You don't have to have R, you don't have to have SPSS. So anyone can do whatever sort of quick little analyses they want. You can do, I think, even just a basic regression and stuff like that. But you essentially select which variables you want to see, which controls, you just type them in and hit build the table, and it gives you your results. It's really nice. It's a way that Icpsr is trying to give access to this research, to these tools, to knowledge, to people who wouldn't necessarily have access to that. So this is just something nice that we were lucky enough to have part of in our archive. But yeah, that's pretty much it. So if any of you have questions, feel free to answer them. This right here is just our a QR code for our LinkedIn, our link tree. If you scan it, you'll get access to the link tree, which is this right here. You can go directly to the website. You can sign up for our quarterly newsletter. You can see the latest data release, some other stuff. And then you can follow us on either Instagram, Facebook, LinkedIn, or Twitter. That's all in our link tree. So whichever one you want, or if you want to follow all of them, that'd be great too. We'd love to have more followers for that and keep you guys up to date with stuff that we have going on and data releases and stuff like that. We're planning to have another webinar this fall. So if you follow us on social media, you'll be able to see when we're going to do it, what we're going to cover and stuff like that. And then one final announcement, we're going to be at APHA. So in about 6 weeks, I think, November 6th through the 9th, we are going to be in Boston at the APHA annual conference. We'll have a booth in the exhibit hall. We're going to be booth number 123. Should be kind of easy to remember, 123. We'd love for you, if you're going to be there, to come stop by and say hi, get some little knickknacks and goodies, get information, network with us, stuff like that. So feel free to stop by if you're going to be there. And yeah, that's it. So if you guys have questions, please ask away, and I'll be sure to answer them. We have two right now. I'm going to read them out loud and answer them for you. So one of them asked, do you have resources for people to teach with your data in class? I'm a lecturer at a university. Okay, we don't really have exactly like a resource, like, maybe if you could be a little bit more specific, you can definitely use some of our data and teach with it. Someone actually just recently asked if they could do that. So they wanted to download a series and be able to teach with it, give instruction, and also give access to their students to do activities with it. So yeah, that's possible for you to do if you want to do something like that. In terms of like educational resources, we don't really have a lot. Like if you're talking about, oh, I want you to explain to me how social determinants of health work or something like that. We don't have like, a pamphlet or something, but if you have questions like that, you can email us and we'd be more than willing to chat with you about that. Okay, yes, I will. So the URL, someone asked, is it possible to get the URL to this archive? I'll put it in the chat, but if you were able to scan the link tree, which I'll put back up right now, hold on. Yeah, if you scan this right here, the first item on the link tree is the website. So you can go right to it, but let me just go to the chat. I'm actually gonna have to get out of this presentation to do that. So I'm gonna stop sharing for a minute. if I can. Okay. Yeah, let me just get our website real quick and drop it in the chat. And I'll drop our email in there as well. So in case any of you have other questions you don't want to ask right now and you want to ask us later, you can just email us. So here's our email. I'll read it aloud also. It's hmca@icpsr.umich.edu. Yeah, you can just email us. And you know what? I think I sent that to the wrong person. Let me try that again. Sorry. Here's the website. I mean, here's our email, and then here's the website. There. Yeah, someone else brought up that Icpsr has learning guides and exercise modules, and they put a link in there. So, oh, actually, let me put this link in for everyone to see. There we go. Yeah, so if you're interested in that, feel free to check that out as well. But yeah, that's HMCA in a nutshell. And if you all have any other questions, feel free to ask or email us. But that's pretty much what we are and what we do and the sort of stuff that we have in our archive. And I guess I'll just re-emphasize that we are specific to what we archive because we have an outside funder, and this funder tells us what we can and cannot, or essentially they fund the research and then we just archive it. So yeah, all Rwjf specific stuff, you come to us and you can get access to it. But yeah, it was really great talking to you all. I don't see any more questions, but I'm willing to hang out a little while longer in case any of you do have questions. Maybe like 1, 2, 3 minutes or so. And you can also, I don't know if you can chat and unmute yourself, but if you can, feel free to do that too. On my end, I can't see any of you. So yeah, just feel free to do however you can. Okay, we have one in the Q&A. Okay, right now we don't. We can check if you, so someone asked, do you have any COVID data? So COVID-19 related, pandemic related data. We don't, right? Like as of today, no. There might be some in the works because obviously it was a big deal and people are doing research on that right now. There's other archives that have stuff that is related to that within Icpsr, but specific to us, Rwjf, I think I can check the queue to what they've funded and get back to you if you want to leave your email if you're really that interested. But as of right now, we don't have any COVID-19 related data in our archive. Thank you for your question. We've got some more questions here. Okay, someone asked, do you have data on nurses? We do. There is a series actually. It's a survey that asks nurses about what they go through, what their opinions are on healthcare reform, how they react to certain issues that are being put up politically and stuff like that. And you can find all of that. If you literally, I will actually share my screen for a second to show you how to do that. Okay, let's do this real quick. Okay. So yeah, you can see my screen, right? I hope so. If you just, this is our main homepage right here. You can pretty much just go like this, nurses, and you can see all sorts of stuff. We have all sorts of data about nurses. These are studies. There's publications about nurses, and you can even go by variable to see what's been asked and what it has to do with a nurse. So basic, are you a nurse sort of question, you know, other stuff like that. Thank you for your question. That was a good one. We have another question. What is the typical time frame from the data collection to when it's available in the archive? Good question. It's a few months. So we do actually have some people who specifically work with our data who do the curation process. I don't have like a specific or a definite time frame, excuse me, to give you, but it takes, a couple of months. So we get the data, it goes through our curation process, they do whatever they have to do to it, and then they upload it, it gets checked again, and then within like a week from then, it's available for you to use. So I'm going to say like maybe more than 2 months, probably a 4 to 6 week process, maybe a little bit more depending on what we've got built up in the queue and stuff like that. But yeah, thank you for your question. And I think that was the last one we had time for. So I'm going to just hand it back to Annalie here.
Fantastic. Tyler, that was wonderful. Thank you so much for walking us through HMCA. I didn't know about that series, so I now have it open on another tab. I can't wait to dig into that one. Thank you all to everyone who joined us. Thank you for the great conversation that was happening in FeedLoop. Our next presentation is an overview of our National Addiction and HIV Archive program. So join us for that in session starting at 12 p.m. Eastern time. Feel free to bring your food. No one can see you, so you're welcome to eat while you learn. And thank you again to Tyler. This was a tremendous presentation. Thank you all for all of the great questions, and we will see you at the next data fair session. Thanks, everyone.